The ABMS Portfolio Program allows sponsor organizations to award continuing certification credit to their physicians and their PAs who are working in improvement initiatives. You can give incentive for physicians to participate in your strategic priorities. At your program level, it adds value to your CME program because you can say, not only can I give you CME credit, but I can also give you this continuing certification credit as well. And then, of course, it's beneficial at the physician level because they're getting credit for work they're already doing in their practice. They don't have to go outside and find something extra. In order to become a portfolio program sponsor, an organization needs to be in the healthcare space, and they need to, in some way, be offering improvement opportunities to physicians. And they need to have an oversight process for those quality improvement initiatives, leadership support, and the ability to monitor and track participation of those physicians. Typically, portfolio program sponsors are sitting in either the CME space or the QI space, although they can really sit anywhere that best fits the organization, and it can be implemented in whatever way suits the organization best. A recent survey of portfolio program sponsors showed us that most organizations have one full FTE, although it can range anywhere from 0.25 to about 6 staff, and that is anywhere from management to physician leadership. In order to receive continuing certification credit, a physician needs to identify a gap in practice, figure out what metrics they're going to utilize, take a baseline, implement an intervention, and after some appropriate period of time, measure again, and then attest that they did that work.